I have been in the medical field for over 5 decades and I have seen tremendous progress in medical science. We now have robotic surgery, we have organ transplants for most of the organs that fail, and many cancers are treatable. However, one change that has happened, which I would prefer had not changed, is that we have moved from a family physician to specialist care. I have always felt that the family physician is the best first contact for any family with a medical illness, and after a thorough evaluation by the family physician, they should guide you to the concerned specialist. Directly going to the specialist is never a good option, and that is something that we need to create awareness about. A patient has to be seen holistically, their family situation assessed, and specialists need to be called in only when there is a need for a specialist to take care of the given patient. So I do exhort the society and the medical fraternity to go back to the good old days of family practice, which I still believe can be revived and would be a great asset to the society. The family physician is still your best bet for early care and also to send you in the right direction.
Family physician, as the name suggests, is someone who's much more than a simple doctor. An individual who's treated generations of families. So you have family physicians who treat grandfather, father, son, who know everything about the family, the past history, the past medical history, the personal history, their personal habits, things that can have a direct impact on health. All of us have seen that over the last couple of decades, the number of family physicians has reduced drastically.
The family doctor concept has slowly but steadily declined over the last couple of decades. And I think that's a big problem as far as delivering healthcare is concerned. Family doctors are actually there to have that important connect between the specialized care as well as the family. Many times as a child, I remember my family doctor being pretty much a part of my family. All major health decisions were taken in conjunction with them, and there was a lot of trust. Over a period of last 2 to 3 decades, we have seen that kind of a trust has slowly diminished to the point that we are now bypassing the family doctor completely and going to seek specialized care. That puts unnecessary strain on the specializations to actually cater to patients which could have been easily taken care by the primary care, and the primary care being given by the family doctor. Also, because the family doctor had such a good connect with the family, when the specialists were indeed involved for a particular case, they were able to communicate much better through the family doctor to the families, and they were able to understand what was going on with their patient, because the family doctor knew the dynamics within the family. The family doctor knew how to communicate and who to communicate, who was the team leader, who was the main important person in that particular family, and that made the communication very easy. Most importantly, remember that in our country, it is still the primary seeker, the primary healthcare provider, which is our family doctor, is the one who would still play a larger role on our day-to-day health issues. And it is imperative that we keep on the culture of family doctor going on so that we can have a better and standardized healthcare moving forward.
Is the role of family physicians diminishing, and what is the significance of family physician? This is a very relevant question nowadays, because according to me, family physicians play a very important role in the delivery of healthcare. He is the first point of contact for a patient and usually would know the patient and the family background and the health background in detail, because he's been following up the patient for a very long time. Yes, I think the role of family doctors is diminishing nowadays because many people directly prefer to go to a specialist, directly visit a hospital. But in my mind, I think that is not entirely the right approach, because many a times specialists look at their particular field and look at the patient from a particular field point of view. But a family physician may be able to assimilate all that information, all the clinical data, all the treatment modalities, and give a single treatment protocol for the patient to be followed. So I think the role is very important, and also there is one-to-one personal connect between the family doctor and the patient. So he's very important. I would say a central role in the delivery of healthcare.
On the occasion of 1st July, that is celebrated as Doctors' Day, I would like to extend my warm wishes to all my fellow colleagues, doctors, clinicians, surgeons, and all other audience who has been listening to the video. On this special day, I would like to stress upon one pertinent thing that and a worrisome thing, that the gradual extension of the family physician in our neighborhood, in our practice. Let me tell you, my friends, after the repeated pandemic attacks by the COVID disease, we have realized that it is so important to have a family physician, a local guardian, you can say a local medical guardian in every community and neighborhood, which becomes the first point of contact for the early pickup of all the communicable and non-communicable diseases, and also they become the great source of reference for all the specialist physicians and the surgeons. So my take-home message for this particular day is that we must not let the MBBS fellow colleagues, the general practitioners and the family physician get extinct, because they are the biggest pool and the biggest reference pool for all of us, not only for our specialized care but also as the first line of defense for the community, because they have built good rapport with the clinicians and the specialists, and they have a one-to-one contact with all the neighborhood. So let's pledge together to keep the family medicine alive, to keep the a proper referral system of primary health care to secondary to tertiary alive in our system, so as to have the best medical care being delivered right from the periphery till the tertiary level, and also to continually check the disease burden being posed by all the diseases including COVID and other non-communicable diseases.
I think that is a very appropriate theme, as the family doctor is the key person to whom a family turns to in case of any health related issues. And especially when a child is born, their vaccination programs, their nutritional guidance, and for the elderly in the family to attend to their chronic illnesses, for any preventive advice, the best person to go to is the family doctor. The family doctor is the person to go to in case of any distress, and he is the guide and the advisor to the family. He can attend to some small acute problems like a flu, give the guidance for the vaccination, send a pregnant lady to the right obstetrician, and if somebody is having chronic cough, then direct them to a pulmonary physician where either a pneumonia or a chest related complication can be picked up. If there is a further problem like chronic fevers which are not going away with a simple medication, then the patient can be referred by the family doctor to a higher center for the workup. And especially when the population in India is also aging, it's very important to work up the cases for their cardiac or long-standing diabetes or hypertension and their related complications. So a family doctor is the right person to know what the nutritional status of a person is, what their medications are, if there are any acute changes that come, then how to handle them. So he is the key person in the overall care of a community, especially the families.
Now, being a cancer surgeon, today I would like to highlight another area which needs recognition, is the role of family physician in cancer care delivery. Now, the family physicians are uniquely positioned in the community. Now, majority of the patients, they go to these family physicians for their ailments. Now, these family physicians identify the early signs of the cancers, diagnose them and send them to cancer specialists and cancer treatment centers so that the cancer treatment can be started at earliest. Now, we all know if the cancer can be identified and diagnosed in early stage and can be treated adequately, the results are extremely favorable. Now, if we look at the breast cancer, now if the breast cancer can be diagnosed in stage 1 and stage 2, the 5-year survival is almost crossing 90%. Now, the role of family physician is not limited to this early diagnosis. they are very, very important in spreading the message of cancer prevention. They can counsel the patients and the relatives for risk factors. The risk factors have to be curtailed down so that the incidence of the cancer comes down. They are also equally important for cancer screening. Moreover, once the cancer treatment is over, they have an enormous role in providing the cancer rehabilitation and the follow-up. So family physicians are a very important part of this chain of cancer care delivery. We need to laud the efforts of our fellow family physicians.
When we talk about family physicians, they are a very, very important part of medicine because they form the most important bridge between the patient and the community as well as specialist services in hospital. An astute family physician looks after patients at every stage of life, be it a newborn, be it pregnancy, be it pediatric care, be it acute or chronic illnesses in the adults, or end-of-life care and palliation at home. The most important thing which we used to see when we were children was to have astute family physicians who knew everything about you and would refer you to a specialist when the requirement arose. They are specialized individuals. They are not just general practitioners, but they are specialized to review patients in a holistic way. And family physicians, when they work, are able to function well in the community. It leads to better diagnostic accuracy, early referral when required, reduced hospitalizations, and overall better health outcomes. Because sometimes patients wait for days before a specialist care is received. And therefore, family medicine forms an extremely essential part because not only do they treat diseases, they also have a major role to play in prevention of diseases and doing timely vaccinations. With the scope of specializations in other branches increasing significantly, the importance of family medicine or people wanting to join family medicine is becoming lesser. Overall, in this way, in a community like ours, where there is so much discrepancy of doctor to patient ratio, many patients suffer because they do not get an appointment with specialist services straight away and sometimes have to go from one specialist to the other. Whereas the role of family medicine physician would have been to see that patient, diagnose them early, and then refer to specialist services, hence saving time, money, as well as efforts and the overall health of patients.
Family doctors serve a very important role in the ground level connect with the people or patients who need medical care. This is more so in underserved or underpenetrated areas, rural, suburban areas who may not have access to secondary or tertiary level care. In urban areas, of course, it's a different story. A person will directly approach the super specialist rather than go to the family doctor. However, the role of the family doctor assumes importance where secondary care or the tertiary care is not readily available or because they are constrained for time. And here it is that the importance of having a sound, well cross-trained family doctor. Hitherto, we have had a situation which has evolved very rapidly over the past couple of decades with greater access to information, communication, internet and mobile telephony has changed everything. Expectations are higher. Today the value of a human life is much higher, which places an increasing burden on the healthcare system to address by way of getting in place a set of family doctors or family physicians who are better trained than they have been hitherto. We have this compares with developed economies like let us say the UK, Australia or the US, where the family physician is an important entity. The tertiary care is not as important as it is said to be here. It's a specialty in itself.
Hospital care is not the answer for all our health needs. We need to move care closer to home and we need to move healthcare into the community. And family physician is at the center of the provision of healthcare in the community closer to home. Family physician is that sort of person who not only looks after your individual health, but looks after the health of your family, looks after the health of the community, and ultimately of that whole society. They are the people who build long-term relationships with you. They build a relationship of trust where you can go and talk to them in confidence about certain issues you may not feel comfortable talking to a hospital doctor. Issues like mental health, issues related to sexual health, or to substance abuse. Family physician doctors are those that provide that continuum of care. So when you come out of the hospital, they will look after your health needs at home. They will look after your diabetes and hypertension and make sure you are keeping well with these long-term chronic conditions.
Yes, I do believe that the role of family physician has diminished in the past couple of decades, especially with a lot of medical treatment coming up, a lot of corporate hospitals coming up. The system of how a patient is taken care of is gradually changing. More and more, we are moving more and more towards specialist care rather than a general family physician type of care. So yes, the significance has diminished when we hear, now we don't have something known as family doctors, which we used to have, say, 20-30 years back. That concept has gradually faded away, is not completely faded away, but is a process of gradually fading away. Unfortunately, this is an unfortunate thing because the impact, it creates a kind of a mistrust among patients. They have a lot of trust towards their family doctor. Now, since that concept is going, there is an unfortunate build-up of a feeling of mistrust, a feeling of whether to really trust the doctor they are being treated with, and that results in doctor shopping, something we doctors known as doctor shopping. A patient takes multiple consultations, he visits 5 hospitals, and he ends up actually getting various advices and wastes his precious time, money, effort. So, and the ultimate treatment remains practically the same. So, all these things are better avoided if they have a trustworthy doctor. And if the doctor says that, no, I know that hospital is good, that doctor is good, you should visit them. So I think that the trust deficit that has developed over the years, this might go.